Hi, I'm Diana Hernandez, Communications Assistant for the City of Enid. Thank you for viewing another COVID-19 live update. Special guest today is Marketing Director Elaine Jones at Golden Oaks Village. Hi, Elaine.
Hi, I'm so thankful to be here today. Thanks for having me.
Thank you. And so I'm going to jump right into questions, Elaine. How has COVID-19 affected Golden Oaks Village?
Well, we watched just like the rest of our country did when that virus started overseas, never even thinking it would affect us. And, on February 29th, which was close to Gary Lilly's birthday, our general manager, he actually walked out and locked the doors at Golden Oaks to start the process and implement procedures to help prevent this virus from coming into our facility. Just surreal to think that it would affect us in that way.
Yeah, I think a lot of people thought that when we saw it overseas and now it's home. So are you guys following CDC guidelines?
Oh, yes. It's business as normal for us. So we began following the CDC guidelines, the Oklahoma State Department of Health. They have mandates that they put in place that we provide the safety of our residents, which is the most important thing that we do. And so to protect the lives of our residents, we immediately started following those guidelines.
Now, are there new training and education for staff, for residents, and family members?
Well, all licensed facilities like us have an emergency management program, and we all have guidelines in place that in the event of any kind of natural disaster or anything like that, we have plans in place on what we're going to do with our residents. But with this virus, we had to incorporate some new training and implement that because of the risk of exposure and then how we were going to prevent the spread of it in the event we had any kind of a confirmed case. So yes, we definitely had to put in new training and education for our staff because it was something that it was a different thing that we had to deal with.
Now, COVID-19 is particularly more dangerous for seniors. Have you revamped disinfecting, sanitizing, control there when it comes to cleaning?
Yes, our director of nursing and our nursing staff have really kept up to date and understanding the transmission of this disease, the severity of how it is, and the risk factors for infection are extremely important. So they've established different protocols to do as far as sanitation, as far as how we receive packages, as far as how we receive mail. And the transmission of this virus is so unclear. So we've kind of been very proactive in establishing those protocols to make sure that we, again, are preventing that virus from coming into our facility.
Now, when you say protocols, are you speaking of protocols like checking for symptoms? And if there was an outbreak, having a protocol in place to be able to rapidly identify people? Are those protocols, is that what you're talking about?
Those are some. We do have sanitation protocols that our housekeeping department is doing. We have food prep protocols in place for that. But we always do screening on our residents. That is just part of our normal routine that we do with our care. And so regardless of whether it's long-term or short-term rehabilitation, whether it's assisted living or a residential care, they're always checked for, temperature screening and coughs and congestion and fevers and other symptoms that raise concern, that would cause us to have to seek some kind of additional testing or swabs or things like that we would have to do. But that's part of our normal protocol. The other things, that we've had to take into effect are the protective gear and things like that's had to be implemented.
Now, how different is visiting now?
That is probably one of the biggest changes in our facility is when we actually had to lock the doors. Mm-hmm. And, it's just our mission to provide a safe environment for our residents. So we had to completely restrict any kind of visitors, any kind of vendors bringing things in, even our mail service. We've had to change how we handle mail service. So everything is brought into the breezeway. We bring it in, we put it in an isolated area and quarantine it for 24 hours before we deliver it to the residents. So, they've given us how long the virus stays on cardboard, how long the virus stays on different types of materials. So we've had to take into account all of that and sanitize and sterilize everything before we give it to our residents. So our residents are getting their newspapers a day late, mm-hmm. their mail a day later than what they would normally do. But that's the best thing we could do to keep them safe and make sure we don't allow that transmission into our facility.
So have you restricted non-essential personnel as well?
Yes. Most of our personnel are essential, so we haven't had to lay off any staff. We have not had any furloughs. Mm-hmm. Even my position, which is more dealing with the business aspect of independent care, mm-hmm. My role has even changed to where it's no more resident-centered. So I'm making more wellness calls to our people in our facility. I'm checking on them. I'm making sure they're feeling well, and checking on our people that live out by the lake, and checking on our people that live in our cottages and apartment complexes. So, yes, roles have changed in this pandemic, but we still have 100% of our staff here.
Great. And I believe we're seeing that a lot, especially in the medical field or caregiving field, that a lot of people are going above and beyond and doing duties that normally they wouldn't. So thank you for doing that. Elaine, how has this opened a different medium for families to stay connected to loved ones who are at Golden Oaks?
Well, they've stayed in touch through phone conversations like they would with their cell phones and just the regular methods of communication. But we've increased our social media output, our email output, iPad conversations that they bring in electronics and allow them to FaceTime with their family members. And then we're receiving a lot of letters from home. If you can still believe it, people still do know how to write letters. And so they're writing letters and sending cards and sending little notes of love and things like that to their family members. And then we, in turn, are posting pictures of their family members, letting them know that, hey, we're okay, and doing the same with videos. That's been fun.
Great. Now, how have residents been able to abide by the guidelines with social distancing?
Well, we've really had to take a strict stand here at Golden Oaks, even our independent residents that live in the apartment complex, because we have two 5-story apartment complexes here. And we're nearly full of residents, but we've had to ask them to shelter in place, just like we did across this community where everyone is sheltering in place at home. Our residents have had to shelter in place too. We've had to go, instead of group meals that people come down and they socialize and they have meals together, we can't have gatherings of 10 or more people. So our food service department has had to make to-go meals. And so we kind of restrict the people that are coming down to pick up their meals. They do social distancing. We don't allow more than 10 people in our atrium at one time. And so we've been really working hard to protect the residents. You might say we're a little overprotective, but it's changed even how we entertain our residents. Our staff has been real creative in coming up with ways to still have fun while we're staying safe. we're providing room service into our long-term care center. They love it. They think it's a treat. They feel like they're kings and queens. We have host sing-alongs in the hallways. They have traveling beauty carts that go through and do things. Children are coming by and they're painting pictures on the windows, and everybody's still practicing the social distancing. They can go outside because we do have a secure area outside that's away from public access. And so our residents in our long-term care facility are able to go out and enjoy the flowers and the greenery. And we're even working on a memory journal that the residents will be able to do and document special memories. So they can pass that on to their family and document some of the things they've been going through over the last few weeks.
Now, social distancing is not the same as social isolation. What are new programs that Golden Oaks has implemented to help connect residents with others?
Well, again, we do have a few that come down. They still socialize in the atrium. They do follow the social distancing rules. We have started implementing the wearing of masks. That was very early on that we started doing that. Mm-hmm. Now some of our residents are also doing that. We as employees have been asked, if all possible, to do curbside pickup and delivery services with our residents. We're helping them with grocery purchasing, and we're actually going out and picking that up for them and bringing it back. We're doing a lot of things staff-wise to assist our residents since they cannot get out. So we're doing more social distancing observing here, and we've kind of canceled a lot of the group activities and entertainment and things that go on, but we're still managing to still have a lot of fun while we're here.
So because you're in a direct contact field and caregiving field, how are the workers, the staff, able to practice social distancing while at the same time be in direct contact with residents?
Well, our residents have personal protective gear that they wear when they take care of our residents. At first, it was a little alarming for the residents because they were unsure of people wearing masks and things. But they also realized that we are protecting them. And so the transition to that was very simple. It hadn't caused any alarm with our residents. We've addressed absenteeism, which we have very little of. We have plans in place for that. We're also asking our staff to watch out, for their family at home too. And so we do put a lot, at this time, all of our healthcare workers are under a lot of stress, having to deal with this disease. We are just blessed that we do not have any incidents of this disease in our facility. So our staff shelters in place. We have plans in the event that we did have some type of a breakout. We have plans of action in place. Our staff has been cooperative, and many of them have actually volunteered in the event we need to isolate for hands-on patient care. So we've just had we have a wonderful group of staff, and they are all working very well together, very well organized in support of this and our residents.
That is definitely something that has been seen in many, many places where people just come together to take care of patients, residents, and people who they're taking care of. So that's great to hear. Now, when it comes to
our staff,
go on.
Our staff also had to take on additional roles because we don't have volunteers coming in to be able to do things with them anymore. So our staff has actually taken on additional roles to do those things too.
That's good to hear. That's great. Now, supplies and equipment, PPE. You guys are wearing PPE, mask. Now, are you worried of a shortage or possibly down the line not having enough?
Oh, with all the healthcare workers caring for residents across our state and even across this nation, there is definitely a shortage in personal protective equipment. We call it PPE, so people will understand. You know, a lot of our orders are unable to be met now by our traditional vendors and our supply chains, and some of the things our administrators have been trying to find alternative sources for. And thank God for our regional emergency management response director, Paulette Marshall, and she has been extremely dedicated in sending us resources and updates. She's kept us abreast of all the advisories, the situational updates, and then when PPE is available, she advises everybody of what we can get. So we've been very blessed by some of the state resources that have been helping us to make sure that we have enough PPE. The requirement for nursing homes is 10-day supply, and so in the event of a massive breakout, that could go in days. So PPE is very much in demand.
Now, have you implemented PPE or the use of face masks universally for both residents and staff?
Our staff is wearing face masks. Even our leadership staff and food service staff, housekeeping, everyone is wearing masks. We're very blessed that we've received some homemade masks, and so therefore we've been able to share those around our community. And then the residents, of course, they haven't asked for masks. A few of them have, and so as they ask for them, we give them also. But any staff that leaves their place of work, like even when I leave my office to go to the atrium or to the long-term care center or over to the front desk, I have to wear my mask out of my office. So yes, we're very strict on that.
Good. Now, if in the case a resident tests positive for COVID-19, do you guys have quarantine rooms?
We are prepared in the event that we ever have a breakout in our community, that we have set aside an area that would be strictly for COVID-19 patients. And so we are definitely prepared for that. Our staff is prepared for that. And so they've embraced the training, they've embraced all the adjustments, and they are still continuing to provide the best care for our residents. And so every day we talk about the basketball and the football heroes, and we see them on TV, but the real heroes are the day-to-day workers that come to work day in and day out, that care for these people, who rely on them for their meals and their bathing and their medication management, their entertainment, and our staff is just doing a brilliant job of keeping everybody comfortable and bringing hope to the residents that this will end soon. So we're excited about that.
Yes. Now, in the event, if a resident tests positive for COVID-19, is quarantined, how can family members stay connected to that person?
Well, it's going to depend on the severity of their illness. We definitely have to make sure that they're capable of communication at that time. So, but we'll follow the same guidelines. We'll do the electronic communication, FaceTime. We'll be in touch with the families to give them constant updates. So we're definitely going to keep communication lines open during this time.
Now, it's easy to say that there is a sense of worry during COVID-19 in this time, but is there a sense of worry at Golden Oaks Village?
No, I don't think so. We're entering, I think, the 6th week of sequestering with our residents, and I'm sure that the family members feel cut off from their loved ones. They worry about whether they're getting the care, their mental health, they're worrying about all those things. But it doesn't restrict them from those other communications that we talked about earlier. We have found unique ways to stay connected to them. We have some residents that do sign language, and I observed their son outside with his mother at the window, and he was signing and speaking to her. We have grandchildren that have come out, and our facility is 5 stories, so they've come out to their balconies on the 3rd and 4th floor, and their grandkids are talking to them from a distance. And so there are great many unique ways to stay connected while everybody's being sequestered. And the feedback from the families has been very, very positive, because they know we're and respect the fact that we are keeping their loved ones safe. They appreciate that. Our residents in the towers have been baking. I know I've probably gained 10 pounds since they've been sequestered, because they're baking and bringing us little goodies as they make them. They've been serenaded as they come down to pick up their lunches, and they're being serenaded by staff. And we've got a resident that plays the piano beautifully, and she plays while they're picking up their lunches. And they still observe their social distancing rules, but they still do some socializing. So life is still good at Golden Oaks. We're doing great here.
That is great to hear. And it's really great how creative people have gotten to stay connected. It's a beautiful thing, actually. So it's really heartwarming. Now, all of this, the changes that have taken place at Golden Oaks, has it been hard for residents and staff?
Yeah, well, yes, definitely. I have to say again that our staff is wonderful. They have embraced all the training and all the adjustments and the changing in roles, and they are still continuing to provide the best care for our residents. So they're going above and beyond their scope of work. We're shopping for our residents now, so we're doing online. We're teaching them how to do online ordering, and that's fun. And then we run out and pick up their groceries and those things. It took our activity director 4 hours, I think, to do shopping on Tuesday at one of the local grocery stores, as she would go grab things, and then she comes back, and of course they're very receptive to us there at the grocery store, because she comes in 90 miles an hour with her face mask, and they allow her to go through the line quickly. And I think she made 5 trips to the grocery store for them. So, but they, even though they're still following all their social distancing guidelines, they're still able to come out and walk around the lake. They're enjoying the wildlife. They're waving to neighbors as they go by. They're receiving wellness calls to make sure they're doing okay. So most of them they're staying home and following the guidelines set by our mayor. They're observing that, even though they live independently.
That's amazing. Now, during this time, a lot of people want to help, and it's tricky now to want to help and volunteer. But what can the community of Enid do to help Golden Oaks Village? Well,
all of the facilities, all of us, our neighboring health facilities, we're all in agreement that PPE is what is much needed.
Okay.
So the best way our community can help our seniors is to send notes of encouragement, to send cards, to send letters, to do visits outside the window, to those that sew. They have been so generous to all our facilities, to all of the long-term care centers in our community with sewing those mats. And those gifts of face coverings help save the inventory of those N95 masks, or that PPE, in the event of an outbreak situation. So it really helps to boost morale, to know that the community is behind us in this fight, because we're not just fighting the virus, we're fighting depression, we're fighting loneliness, we're fighting all kinds of things. And we are so glad that we live in a community that's rallying behind our healthcare workers. And by having these donations and these beautiful little drawings that people send in. It helps them tremendously. So my thing to say to the public is, when you're homebound with your children, make those drawings and write down those little notes and send them to all of our healthcare facilities. But in behalf of Golden Oaks, we want to thank everybody in our community who supported us through this pandemic, because as a nonprofit, non-denominational retirement center, we find comfort in the scriptures that are posted in our home. And they do that every single day. So they post scriptures up every day. And so one of the scriptures we cling to is Psalm 94:19, when it says, "When your anxiety was great within me, your consolation brought joy to my soul." Well, this community has really brought joy to our soul. Our staff has brought joy to our soul. Our residents have brought joy to our soul. And we are so thankful that the Lord is ever-present help in troubling times. And we are so thankful for his watch care over Golden Oaks. And so thank you to the community. Thank you to God, and thank you to everybody and staff and our hard workers that are doing so much here for everything that they're doing for our residents. Without them, we couldn't have gotten through this virus.
Thank you. Thank you, Elaine, for what you are doing. I know that in crisis, it's easy to focus on the negative. It's easy to get sucked into all the negativity. But you see during this time right now, and there's a lot of glimpses of heroism, how people are stepping up and doing their part and helping however way they can, sewing, and it's really great. Now, I want to ask another question about sending supplies. Who do they contact if they want to send supplies to any nursing home? Is there just call the number, or if kids want to mail letters or pictures, how do they go about doing that?
Well, absolutely. They can always post things to our Golden Oaks Facebook site. If they want to send things via mail, it can go to Golden Oaks, and we call it #ShareTheCheer. And you can send that to 5801 North Oakwood Road in Enid, Oklahoma, 73703. And if you have any questions, you can always call me at 580-249-2600 and just ask for Elaine.
Thank you, Elaine, for your time. Thank you for what you are doing, and thank you for all the nursing facilities and taking care of our own. And it is such an honor to be able to hear what you guys are doing and rallying for the residents, and it's a great deed. It really is. Do you have any closing?
Well, thank you.
Do you have any closing comments, Elaine?
No, I just again want to thank the community for their support of all of our facilities. In this, all of our health facilities across this city are in dire need of that support. And so thank you to each and every person in this community that has gone to those nursing homes across this city and have done things using those social distancing guidelines for our residents to bring them cheer, to bring them hope, to bring them joy, to bring them laughter. Yes. We appreciate you very much.
Thank you, Elaine, for your time. And thank you, viewers, for watching. This has been another COVID-19 live update. Join us tomorrow for another COVID-19 update with the Enid Public Library and neat ways they are still serving you in this time. Thank you.